It is now 10:03 a.m. and we can begin our webinar. Our topic for this month is Encounter Data Quality Improvement Efforts, Part 3. I would like to introduce myself. My name is Felicia Oropeza, a Research Data Specialist 2 for the Managed Care Data Support section, and I am the webinar moderator for the current month's webinar. Today's agenda for quality measures for Encounter Data QMed 2.0 will include the following items: QMed update recap, all plan letter review status and QMed 2.0 timeline, and the plan feedback. The speakers today will be Christine Fessler and Stefan Lefebvre. The following staff members provide support for the webinar: myself, Felicia Oropeza, Abi Gebrselassie, Mei Sean Ng, Shayang Ma, and Alvin Batista. For general questions, please submit your question to the WebEx chat, and please ensure that your questions are visible to all participants because I am not monitoring the chat. Once again, if you have any questions from the webinar, please go ahead and unmute yourself and put your comments and questions in the chat. For specific questions, please reach out to the appropriate data mailbox, as will be instructed closer to the end of this presentation. Before we move on, today's webinar is being recorded for documentation purposes. Links to Part 1 and Part 2 of the EDIP series are included in the presentation. The recorded video script and presentation materials will be uploaded to Data Reporting and Monitoring webinar series. The glossary and FAQs are also updated regularly every month. As a reminder, please turn off your microphone now if you are not presenting. Thank you all, and now I would like to introduce Christine Fessler, Chief of the Data Quality Reporting Branch, who will speak on quality measures for Encounter Data, Update 3.
Good morning. Can everybody hear me all right? Yes? Okay, awesome. Thank you. I'm having WebEx, I'm having some video issues here, so I apologize. I will be off camera, but that is not the most important thing. So welcome, welcome. Thank you all very much for joining our webinar. And welcome to our part 3 of QMed 2.0. And right here, QMed, we love our acronyms at DHCS, but QMed does stand for Quality Measures for Encounter Data. So welcome all as we proceed with our third discussion on this topic. For anyone who is interested in reviewing the prior presentations, you can find those on the webinar series. They have a wonderful web page for you to look at the current year's and the prior year's presentations and links to the videos on YouTube, which is a really wonderful resource. And we thank our colleagues here for helping host and leading these webinar series. So let's get into it. Today we will be discussing, again, QMed 2.0. And just to give a quick recap, some of the material in this webinar series. The first portion, I will be reviewing some very important information that do relate to CMS reporting requirements and potential impacts to funding. So some of this information, I will try to drop links to the material referenced in these slides, as I know you all don't have access to the slides yet, but bear with me. I'm pretty terrible at multitasking, so you may just have to wait till I kind of am done with my speaking sections for me to paste those links in to our chat here. So any anyway, it's just really important for plans to review any communications from CMS and to review what I will be presenting in the upcoming slides. So if we could please turn to the next slide. Okay, so this is just a review of encounter data. In the reporting unit, we love our encounter data, and you will be hearing from one of the wonderful SMEs, Stephen Lefebvre. If you have had any encounter data validation testing with him, he is really wonderful. A lot of knowledge that he has. So thank you, Stephen, to assisting me this morning. But yes, we do love our encounter data. It is a very key source of data that impacts a lot of reporting calculations that DHCS does, and our reporting to CMS as well. So whatever the encounter data that we get is sent to CMS. So that's why we have a very synergistic relationship with the plans, our trading partners here, that we really need to work with the plans to get quality encounter data submitted so that we can provide high quality data to CMS. And so again, here, this lists just some of the various programs and, estimating utilization, capitated rate development. This all requires high quality encounter data. So just a reminder here, and let's go ahead and go to the next slide. All right, so this slide just kind of repoints or refers our trading partners to the boilerplate contract language on encounter data reporting. And again, the data quality measures that we have, some of you might be familiar with the CART, which is completeness, accuracy, reasonability, and timeliness. QMed 2.0 will include additional measures such as uniqueness, but all of that is in relation to trying to capture metrics and measures for the contractual obligations. So, and again, DHCS, we do require the plans, they have to submit using the National Standard File formats, which is ASC X12 for 837 institutional, professional, and dental encounter records. Then there's NCPDP and the national standards ASC X12 for 835. And again, these are HIPAA compliant and required to meet California specific reporting as well as federal Medicaid and HIPAA reporting requirements. I would like to take a quick advertising break to highlight the agenda for the upcoming webinar series, in that the reporting unit and data exchange and our PACES team here, we are hoping in this August, that we can do a webinar series specific to the DHCS Documentation Center and help plans. We'll walk through the documents, the folders, and highlight some of the more California Medi-Cal specific reporting requirements, some of the resources that we would like plans to be able to refer to. So yeah, so just a quick break there on the upcoming webinar series. So let's go ahead and go to the next slide, please. All right, so this one is reaffirming the federal obligations and the final rule. And so with this one here, it's just reminding the plans, and it's what DHCS has to do. All of the health information systems have to be able to capture very specific information, such as member enrollment, eligibility, claims, and payment information. So it is the payment information that is especially important for the information that DHCS does report to CMS. So some of those include the allowed amount and paid amount. And one of the things to highlight is there are financial consequences for plans that are not in compliance with these federal requirements. So there are some very specific links here, health information systems, then also some of the other CMS resources there for you to look at. Again, I will be pasting these links in chat in a little bit here. So it's just, it's really important for DHCS to help the trading partners understand how, what sort of resources they need, if there's any additional education and outreach. We really want to understand what can we do to help our trading partners and plans be able to submit high quality encounter data to CMS because it also benefits DHCS as well. So if we could go ahead to the next slide, please. So this, again, this is specific to enrollee encounter data. So here we've highlighted some specific sections regarding the 438.818, which is enrollee encounter data. And just some of the key takeaways to highlight is that if the state, if DHCS, if there's issues that CMS finds with the data that we submit to DHCS, it could impact the funding that we get. So there could be some funding cuts or future funding impacts depending on the specific type of patients or services affected by the data problem. So this is one of the things that we would like to highlight as something we can all work on going forward. And next slide. All right, so TMSIS reporting. This is very important. And it's around the timeliness. So again, payment information is the timeliness of the data that's reported to CMS on a monthly basis. One of the future QMed 2.0 measures we would be very focused on is, again, it goes back to the payment and amount paid, allowed amount, is the use of contract types. So just a reminder that for contract types, for capitated plans that are submitting encounter records to DHCS with contract type codes of others, that is not expected given what contract type 09 is, and it's not appropriate for capitation. So that's one of the things that DHCS will be and is working on for kind of go forward communications around contract types and reminding managed care plans what is most appropriate to put in when you are submitting those national standard transaction forms to DHCS PACES. Another one to kind of focus on for the data quality is, again, the local codes. Which it is another focus for the education and outreach. So DHCS we want to work with plans to better understand how they can work with providers to submit the claims to the plans with the expected national codes rather than the local codes. So more information to come on that. We have heard from some of our larger plans that they still are receiving some claims with those local codes. So it's something that is an ongoing issue, and we need to help you all understand, work with you to get those providers to send the high quality encounter data to you. Okay, so next slide, please. All right, so now we're going to go on to QMed. QMed, this is just a brief background for QMed. And again, this is the section that will not apply to all of our attendees here, and I apologize, but this is a great way for us to be able to reach out to all of our trading partners at once. But if this does not look familiar to you, it's because you are likely not receiving a QMed quarterly report card. So the QMed report card was developed back in 2015 as a way to assess data quality of encounter data. And this is specific to the medical managed care plans. There are about 22 right now that receive a quarterly QMed report card. So yes, we can go ahead and go on to the next slide. So one of the issues with the QMed 1.1 is it hasn't been updated since 2024 when pharmacy was carved out as impacting the measures. But again, QMed 2.0 is looking at reducing the complexity of the data quality measures, how they were calculated. The current QMed 1.1 measures are not really salient, just given how the scores are aggregated. So part of what we're doing, and we're calling this phase one, and again, we're focused on those 22 medical managed care plans that are currently receiving a quarterly QMed report card. So we've already decided the measures, and we are going through an internal APL and methodology review process, but we are looking at rolling out a scorecard for QMed 2.0 to those managed care plans in the fall of this year. For the future phases, and again, this is to incorporate some of those other healthcare delivery systems, such as the dental plans, specialty plans, such as the PACE plans, the SCAN plans, and then eventually the county behavioral health plans. So more to come. But we do recognize it's very complex. Some of the other healthcare delivery systems are submitting data in different formats or to other systems. So that will be a longer term project for our team working with Manat to figure out from a technology perspective how we can best incorporate all of those different data components into one kind of QMed report card. So this is why it's going to be a longer term project, but we have definitely made good headway in our phase one. So if we could go to the next slide, please. Oh, all right. So this next section is an overview of the all plan letter review status and the QMed 2.0 methodology and report card timeline. So let's go to the next slide, please. All right. So from a high level summary, the APL internal review process, and again, APL is an all plan letter. Many of you should be familiar with this as a form of communication from DHCS when there are any sort of reporting changes or policy changes around data that is sent out to plans. So there was a QMed original when it was rolled out in 2015, the original APL and methodology document that included information and details about what sort of measures were included, how were they calculated, how were the scores aggregated. So we have revamped the APL, updated the methodology report to include the measures that are expected to be in QMed 2.0. And so right now it's been about a 4 to 5 month process to have several of the DHCS internal stakeholders review the APL and the methodology report. Right now we expect in July to have the final division to review. And then we are targeting October 1st for APL publication, the APL and the methodology report for there to be feedback from the plans. So just as mentioned here, in the coming months, we will continue to have internal and external engagement as we prepare for the QMed 2.0 implementation. So the next few slides, there'll be a bit more detail on the overall timeline. And we can go ahead and skip this, the all plan letter. That just includes the type of material that will be included in the APL and methodology report. So let's go ahead and go to the next slide, please. All right, so this is the APL and QMed 2.0 timeline. We've already gone through steps 1, 2, so those are all completed. Right now, we're developing a QMed 2.0 report card. And just to highlight, we did send out a survey from Data Quality Reporting Unit on, it was last Friday, to 22 managed care plans who are currently receiving the QMed 1.1 report card. Stephen will be talking about that section for the survey responses, but as we develop, the QMed 2.0 report card, it's an opportunity to kind of start from scratch and really work with our trading partners and plans to figure out how can we design a report card that is better for your purpose. Like, is what could make it more salient? What do you need to, a PDF side of what sort of format does it need to be in? So we're really looking for some feedback from our trading partners to figure out how we can tailor it to help you all understand the data quality scores so that DHCS can get better data quality. Part 4, I just spoke on that. This is the QMed 2.0 APL methodology report. So we're hoping July to have that completed in the internal review process. October 1st, we are hoping to have that APL methodology report open for public comment. And then again, here, number 7, just the upcoming months, July, September, and through November, December, to continue the webinar series and education and outreach for our phase 1 managed care plans. And then slide 20, if we go to the next slide, please. This is just kind of another layout, again, visual of specifically the DHCS standard APL review process. Just given the complexity and various divisions that need to review, we want to make sure that we get all of the internal stakeholder engagement. Everybody has the opportunity to provide feedback before we do roll that out for plans to review. So again, expected October 1st to publish the APL and DHCS process around collecting the stakeholder feedback from our trading partners. All right, so if we could go to the next slide, please. So this is a timeline for QMed implementation. So one of the things I would like to highlight here is the APL effective date. So we're looking at October 1st. So that would be when the APL and methodology report would be open to plans to review, provide feedback. And one of the goals we are targeting is for the first QMed 2.0 report card to be shared with plans the beginning of January. So essentially, the first QMed report card will be assessing the encounter data submitted to DHCS in October, November, and December, and then receiving a report card in January. So if you are receiving a report card now, it's on a quarterly basis. And the lag time between when a reporting period would end used to be around a couple months. We've kind of changed the internal process where now we are hoping to send those report cards to plans during the same time that you receive an encounter data monthly report. So hopefully within 15 business days of the following month is when we are hoping to have these report cards sent so that it's much more timely for our trading partners to receive and review and address any potential data quality issues. So This is just kind of another timeline layout for us to be aware of a future webinar series, and then also our targeting for QMed 2.0 report card. All right, so if we could go to the next slide. Okay, so I would like to hand it off to Stephen. Stephen, thank you so much. I know I'm leaving it in good hands. So if you could please take it away. Thank you.
Thank you, Christine. And thank you, Alvin, for putting me on camera. I appreciate that. Hello, my name's Stephen Lefebvre. Many of you have worked with me over the years. I've been doing the encounter data for about 7 years now, and I've worked with most of the people in most of the plans. We've had a lot of new plans, and I don't know you, so hello. And today I'm going to be talking about the feedback we solicited and have received in our survey. So while we're developing QMed 2.0, there's going to be points where we kind of want to know where we stand and what your opinions are or what your needs are as we go along the way when different subjects come up. So this is our first, of what could be a couple more surveys. We want to know what you think about where we are. We kind of, before we formulate our finalized QMed, we do want some feedback. So, we want to talk about goals and content. We sent out a Survey Monkey to solicit feedback. We received, as of today, out of, I think it was 22 or 24. We received
22.
15 responses out of, I think it was 22 or 24 that we sent out. So we're doing pretty good. We would like to hear from everybody. If you could please, it'll take you no time at all. And there are also a few that we received, not a lot of responses. Some of the questions weren't answered. So maybe you might want to revisit and go in and send us another one, a follow-up. And, this is for you. We want to know what you think before we move forward. So if you could do that, we would really appreciate it. So our goal is to obtain information on the plans on the current use of QMed 1. How's it working for you? How's the format, the functionality? We want to know, we want criticisms as well as, we don't just want compliments. We don't just want to hear this is working and that's working. We want to know what the challenges are with QMed 1.1 because we're looking to improve it. What are your pain points with QMed 1.1? What are your challenges in getting good scores or understanding the report cards or improving your data quality to improve your QMed scores? What are the pain points? What are your challenges? So we also wanted to talk about topics for future resources, how you use the report cards, how you want to use the report cards and what you want to use them for. We wanted to also know, are you using the companion guides to help guide you and improve your data quality so you can get better scores? Do you, want more information on the companion guides and how to use them? And also, have you read the QMed document? QMed 1.1 has a master document and it lays out all the measure specifications and, what its purpose is and how it kind of works. So, it's not a nuts and bolts programming guide, but it is a description of each metric and it tells you how we calculate it. So that can help you, but how are you using that? Are you using that QMed 1 document, and how also to consume these, potential future resources through the monthly webinar, through the webinar recordings, do tip sheets, would those help? Different kinds of guidance is what we're looking for. What would help you? So this is your chance to, and everything I just talked about, this is your chance to let us know what would be helpful to you. So if your organization, I'm going to read the bottom. If you or your organization received the survey and have not yet filled it out, please do so at your earliest convenience. We're about 33% there, maybe 30% there, or excuse me, 60% there, 65% there. We'd like to get 100%. We'd like to get everybody's feedback. So okay. So I'm just gonna go through really quickly a high level of description of the I don't know why it says 7. Oh, I updated it. Probably they had already opened this webinar when I updated it. So we have received 15 today. So this is gonna kind of talk about what we're hearing so far. So again, this is your chance to chime in. This is your chance to give us input on what you would like to see with QMID 2. So the questions are, question 1 and 2 were who receives in your organization the QMID report and who uses the QMID reports. And your responses are showing that encounter data team, your plans encounter data team across the board are receiving them and they're utilizing them to help with their data quality. But some other responses, there's been some management, compliance, finance, a lot of compliance. Apparently your plans compliant officers are very interested in QMID, which is fantastic. That's by design. And question 3 was, how do you view QMID? So far it's PDF. We're in discussion of potentially what's the best format for QMID 2.0. So we want to know, are you looking at it on a PDF app or your internet browser? That's what you've been saying. We're considering other formats. So we wanted to know how the current format is working. Questions 4 and 5. Basically we're asking how valuable is the current QMID report card in assisting you with identifying encounter data issues or also with improving those encounter data issues. And most responses we're getting are that the report cards are very valuable in identifying and for improving the data quality issues. Question 6, I didn't get many responses on that one. So again, this is your chance. If you want to send a follow-up and say, you know what, we do have challenges. We would like this or that to be reviewed or looked at or considered. Send us that feedback. So question 7 was what QMID related topics would you or your organization like to see covered? So this is what we're asking you. What do you want us to talk about in the webinar series about QMID? What would help you in understanding them or defining certain metrics or, issues like that? So the first number 1 is how to interpret the report cards. You're asking us to explain to you how you should interpret the cards. That's great feedback right there. Okay, next slide, please. This list continues. You want to know what are common issues that we're seeing, which, you only know what your plan's doing. You don't know how other plans are doing. So what are some lessons learned from high-performing plans? There are some plans that are very high performing and very good, and I'm not going to call anyone out, and I'm going to say thanks. But lessons learned from high performing plans. For example, I'll give one example. I have a plan that I've been working with for 7 years now, the whole time I've been doing this, and they wanted to be proactive. So instead of just waiting for the monthly or the quarterly reports to tell them where their deficiencies might lie, they actually wanted to develop their own edit in their systems to mimic QMID. So they could get real-time ad hoc reports on how their performance is with regard to QMID. So they did that. So they can actually go into their system anytime they want and check their performance. And that was something that I assisted them with. I kind of worked with PACES also to, define the elements in our encounter data system that we use. And so we were able to build, I was able to assist them and just, with just the definitions, but they built a system to do QMID on their own, and it's helped them a lot. Their scores are really excellent. So also how to use the reports to improve your data quality, how to use the scores to determine what are some potential issues that you can correct to improve your QMID scores. So moving on, question 8, thinking about future QMID related resources, what formats would you or your organization prefer? So this is resources again for us to assist you. And everybody said webinars. The webinars are good, which is great. We're really happy to hear that. We'd like to know that what we're providing you in these monthly webinars is useful for you in a practical sense. but both live and past recorded webinars. So it's good that we record these because then you can always go back and look at them. And if there was any specific aspect where we provided guidance or training, you'll be able to hear that because we do post them on YouTube. I actually watched them at home. I watched a couple of them at home, and just so I could see my presentation and critique myself. And it was very funny because my kids kept walking away and saying, "Why are you on YouTube? Why do I hear your voice on YouTube?" And my wife, she wanted to hear, and boy, she was full of suggestions. So anyway, also on-demand videos. We're considering making short videos for how to address specific issues. We're considering how we can do that, how we can tailor them for your assistance. And this is something that you've indicated that you're interested in. Also, FAQs, frequently asked questions, workshops potentially, tip sheets. We're looking for any type of suggestions that you can provide on ways that we can cover these issues in methods that would be useful to you. So, and then the last question I'm going to cover, although there were more, were how often do you view the webinars? How often do you attend the webinars? And most responses said most of the time. 9 through 12 months out of the year. That's wonderful news. That's what we want to hear, because if you're not attending the webinars, you could miss, some very important information on how to help you with this. And it's not just QMed also. It's not just encounter data or data quality. This webinar covers many different aspects of Medi-Cal managed care and data. So it's not just encounter data, but we're actually starting to volunteer to provide presentations every month because encounter data is a very complex subject. And it's something that, I've been doing it for 7 years and I learned something every week. I learned a couple of really important things that I just didn't know. It's like, well, how did I operate for 7 years without knowing this information? So we also received frequently. So nobody said they don't go. So that's wonderful. So frequently it's 5 to 8 months out of the year. I encourage you, try to make the time to attend these webinars. And, they provide information on what's upcoming in those webinars. And if you see something that's interesting to you or that could help you, by all means attend. So I was also asked to remind everybody that we will soon be opening up the APL and measure specs for public comment, but that was, Christine just provided those in slides 17 through 20. So if you go back and watch this again, or you want to look at the slide deck again, please look at slides 17 through 20, because that's going to be our next big push is the APL. And we really want to tell you what we're doing and where we're going, where we are, and then potentially it'll give you an opportunity to also give us more feedback. So, and you don't just have to do this survey. If you want to provide us with some kind of feedback, you could just send an email to the Data Quality Reporting Unit inbox and do it that way also. But, we really would appreciate if you did this survey, and if we do other surveys, because we're trying to make this easy for you. We're trying to make this understandable for you. We're trying to make this something that is not a burden to you, but it helps your plan, and keeps you not only in compliance, but with good high QMIT scores. That's what we love to hear, because that says that you're providing the data quality that satisfies our requirements, and mostly our federal requirements that Christine so eloquently pointed out. So, and with that, that's my input. Thank you very much. And so we can go on. I don't know who's presenting next.
Thank you. Thank you, Stephen, for your presentation. We have a couple of questions in the chat. I think we have time to address them. So the first question would be from I think it's Ann Bence, I believe. Bence. Is the DHCS team familiar with any specific type of services or encounters that you all see volume concerns?
I think to get more
Hi,
into
this is
detail
Stephen,
about,
and this is
oh,
something that we have a lot of plans and there's a lot of metrics. So in order to determine that, we would probably kind of have to do a little analysis because otherwise we're looking at one plan and then another plan and another plan, and then we'd have to quantify it all and add it all up and calculate it. So if that's something that I'll talk to Christine about that, and we'll determine if that's something that we can be able to do, because it is going to require a little research to quantify that. So we don't have anything like that just in pocket. So I think
Great.
all these questions will be looked at after this webinar for anything we can't answer on the spot, and then we'll try to determine how we can do that.
Okay, thank you. And the next question. Oh.
if I could just maybe add to Stephen's comment, was while we don't necessarily drill down into specific level of detail that he's talking about, it would take a bit of analysis to answer the question. From kind of a higher level and reason for some of the new measures in QMed 2.0 is we are looking at things like duplicate service lines. So, and those are separated by transaction type. So specifically in QMed 2.0, when we do have the methodology report open for feedback, that is one of the things that is important and on DHCS radar. So it is if there are duplicate service lines in encounter records. So more to come on that front, but thank you very much, Stephen.
Thank you.
I just want to touch on, since Christine mentioned duplicate service lines, and duplicates has been something near and dear to my heart. So those of you who I've worked with for the last 7 years have heard my spiel more than once on duplicates and duplicate service lines. I've been warning about this for many, many years, so it's coming. The duplicate service line issue is coming. And so I would recommend that you start addressing it as soon as you can in your systems. So I just wanted to give you that tip.
Thank you. And another question is from Megan Gordon Gilmore. She asked if we could please repeat what you said about contract type 9. I believe it was addressed to Christine's.
Yeah, so specifically, I will drop in chat, but if you could refer to, if you have access, and we hope you all have access, the DHCS Documentation Center, please refer to the companion guides. There are companion guides for the professional, the institutional, and we encourage plans to refer to those for the guidance on, how they need to be submitting their encounter claims in line with the X12 implementation guide. So I am in mid-process of dropping in chat the portion of the companion guide that speaks to the contract type codes, but this is in the CN1 segment specifically. So we'll continue to do some research, and we will provide detailed answers to these in FAQs. So thank you for your questions. We'll get to it as soon as we can.
And she had another question, whether there will be a draft APL review period for plans.
Yes, there will. As I said, we have one more division to finish up review. We are hoping that will be done by July, and then opening up for plan review, and then hopefully publishing October 1st. So yes, that's between late July to October 1st is our hopefully targeted review process, external review process for plans.
And okay, and there are a few more. There's 3 more. Yes, I found that. So Eric asked regarding local codes. So if the contract code is 5, would you edit on the local codes?
Okay, so we had that question, but we also had questions that are talking about, that were asking about local codes. Local codes will exist as long as is that the one? As long as, I'm sorry, it's scrolling. As Medi-Cal fee-for-service pays them. Yeah, local codes exist, but that is purely fee-for-service. As far as managed care goes, the PACES system will not accept local codes. We've been telling plans as long as I've been here to stop using local codes. Those encounters will be denied. Those encounters will be denied if they have local codes. PACES does not accept local codes for managed care plans. That is only fee for service, which is a completely different area. So, I don't want to dismiss your questions, just out of hand, but there's nothing to answer because we don't take them.
Thank you. And
Debbie Dixon, I want to also address that thing about the specific to me. I put my once and for all and can be used when they cannot as well. So the issues are with the local.
And Sydney Turner had another question. Would it be possible to follow up with feedback in writing? If yes, where would DHCS like that feedback sent to?
So please send
I
any
was trying to tell
questions
Felicia, but then they said, well, just say it, Stephen. So I'm going to just say it. Yeah, you can send questions, especially if they're regarding encounter data. Send any questions to the encounter data quality unit. Actually, no, that's not our email anymore. Data quality reporting unit at dhcs.ca.gov. So that's data quality reporting unit at dhcs.ca.gov. And that's where you can send questions whenever you get them. If you have questions about specific encounters, you have questions about, coding or anything like that, go ahead and send it to us at the data quality reporting unit. That's the first email address at the top of this slide.
And I believe that is all of our questions for now. And just let us know if you want us to take the rest of the questions and back and answer via email. We'll post these questions in the FAQs. And thank you, Christine and Stephen, for your presentations. We will post any other general questions in the FAQ, and we will send out a notification when the questions are answered. DHCS can also send answers directly to people who email mcdss@dhcs.ca.gov. We can get that information directly to the Data Quality Reporting Branch and Christine. These resources are live links to our current mailboxes. This is the list of behavioral health managed care inboxes for specific behavioral health topics. This is the list of dental managed care inboxes for specific dental managed care topics. This is the list of programs for all-inclusive care for the elderly inboxes for PACE topics. This is the list of medical managed care inboxes for specific medical managed care topics. This is the list of technical support inboxes for technical questions. To give you a preview for next month's webinar in July, the topic covered will be Big Picture, Webinar and Beyond. The date of the webinar will be July 30th, 2025, from 10 a.m. to 11 a.m. Is there a question?
We received another question that I would like to answer while we're live. This way we don't have to worry about doing it later. And it was regarding PACE organizations and if they have problems with, like, for example, duplicate questions or something like that. And it was by Juan, I believe. And I don't see his name because we're in the wrong part of the scroll. But if it's relating to encounter data submission issues, then please send that to Data Quality Reporting Unit. PACE compliance is more geared towards, I think that goes to the division that handles PACE organizations and generally, and that would be where your contract manager resides. So the question was, Juan Ariano, for PACE organizations, should we contact PACE compliance at DHCS.ca.gov for specific questions about duplicate rejections? So no duplicate rejections or duplicate denials, depending on rejections would be on the file level, denials would be on the encounter level. Those should be sent to us, and duplicates or any other submission issues should be sent to the Data Quality Reporting Unit email that I mentioned earlier. Thank you.
Thank you. And thank you very much to our presenters, Christine and Stephen, and the support staff. And if you have any additional questions, please feel free to send them to our email inbox listed on the screen here. Thank you, and see you next month.